Experts and policymakers have gathered for the first APIN Public Health Initiative's annual Public Health Symposium to have a conversation on the need to integrate non-communicable diseases in the national HIV and AIDS response. For 23 years, APIN has been leading the implementation of HIV and AIDS projects, providing care and treatment for about 400,000 people in Nigeria.
In the last 16 years, as an indigenous implementing partner, we have implemented at different times on different projects in 26 states in Nigeria. So this is like pitching. One of the things that we have tried to do over the years is that we started by ensuring that we have a program that is ethical compliant or IRB compliant, in which case we make sure that we consented all our patients that were willing to be consented, so that this data, apart from being service delivery data, could be used for a lot of things.
The resultant effect of APIN's efforts is the increase in the life expectancy of people living with HIV and AIDS in Nigeria. However, the conversation here is on how to care for comorbidity among people living with HIV and AIDS and improve their quality of life.
The problem of hypertension, diabetes, cancer, as we know it now, is enormous in the society. And if we don't critically look at how this impacts on the other things that we do on HIV treatment, on HIV prevention, and all these things, and have an holistic view of how to confront the challenges that we have in society, I think it will not go well in the society as a whole.
It makes more economic sense to spend money to diagnose somebody with HIV, to put on treatment, to monitor, and to make sure that the person doesn't die of cardiovascular disease or to have cervical cancer at the end. It's all resource. Every other thing that we've done is a waste.
Non-communicable disease.
Aside HIV and AIDS, APIN currently implements projects in other areas, including emerging infectious disease and global health security, health system strengthening, maternal and child health, as well as tuberculosis and malaria.